Today on Leaders in Healthcare, Dr. Prerana Rudrapatna, the Chief Medical Liaison at My Viva Plan, is an educator passionate about empowering individuals to take control of their health through lifestyle medicine. Learn about the 6 pillars of lifestyle medicine and how to motivate your patients to make meaningful, lasting changes to improve chronic disease, and how you can integrate digital health solutions to foster a deeper level of understanding and engagement with your patients.
So lifestyle medicine has actually become one of the most fastest growing medical specialties. Positive psychology is the field of study where we understand what makes life most worth living. Managing a chronic condition is the challenge.
The vast majority of the time when you see the patient the next time, they have not done it.
Challenges are opportunities for action. You need to be able to build competence. You need to have a clear identified action item so that you can actually move forward. You need unambiguous feedback. The overarching goal is to get the individual reflecting, building self-awareness, so that they understand who they are, what motivates them, and then building that intrinsic motivation. When I met Lorraine Wales, our founder and CEO at the Lifestyle Medicine Conference, I was so wowed that within 10 minutes of talking, I was like, are you hiring?
All right. Dr. Prerana Rudrapatna, thanks so much for joining us today. How you been doing?
Good. Thanks, Jordan. Thanks for having me. I'm doing well. I guess you could say I'm flowing in life.
And when you say flow, what do you mean exactly?
So it's not just a funky term that I came up with. Flowing in life, I'm using that to describe the fact that I'm rewardingly tired. I'm sort of living my best life. I'm doing all the things. Professionally, I feel very accomplished. Personally, I feel accomplished. And so I'm just engaged in a lot of things. I might be overwhelmed, but I feel good about it.
Okay. It sounds like we're like riding the edge of productivity and burnout almost, but we're flowing.
We're flowing. Yeah, it's interesting you make that distinction there because it is actually a concept in the field of positive psychology. It was created by this Hungarian psychologist. I'm probably going to butcher his name, but it's Dr. Csikszentmihalyi, I think. I Googled how to pronounce it, but anyway. So positive psychology is the field of study where we understand what makes life most worth living. So we focus on strengths, well-being, and human flourishing. And in positive psychology, flow is considered to be a key ingredient that helps individuals fulfill their life so that they have joy, purpose, and a sense of achievement. And to help understand this, the psychologist has actually created a fancy graph so you can visualize what it looks like. So on the x-axis, you have your skill level, and it goes from low, medium to high. And then on your y-axis, you've got challenges, and it goes from low, medium to high. So according to this graph, flowing is up here, where your skill level is high, but your challenge level is also high. But you're flowing, you're keeping up with it. So you're kind of like keeping pace, and it's extremely overwhelming. But again, it's bringing you joy. You've got that sense of purpose. And so you're rewardingly tired. You can tip over onto the other end of the scale into burnout and anxiety and worry if your challenge level is high, but your skill level is low. Probably what my
Okay.
life was at the start of med school. Yeah.
And so this applies not just to your professional life, I guess, probably your personal life too, as well, and all the endeavors you're embarking upon. You just having that balance, that matchup between the tasks that you're trying to tackle and how equipped you feel to tackle them.
Yeah, definitely. I think it's more so personal, and then recently I've been able to apply it to professional friendships, I don't know, creativity. It's a concept that I think you can fit within other concepts, and I imagine you're in a state of flow as well at times with all the activities that you have going on with clinical practice and your entrepreneurial stuff. So, yeah.
I think I strive to achieve flow. Having 4 different jobs currently, it often feels like, what's the opposite of flow then?
So directly on the graph, the opposite of flow, I guess if you're looking at it like this, if your challenge level is low and your skill level is low, then you're in apathy, right? So you're in this apathetic state where you probably don't care about life or any of that kind of thing.
I don't know if that quite describes it, but it's somewhere perhaps up in the middle part is where I've been existing
So
much of my time.
yeah, exactly. So I'll actually break it down so people can visualize this. So on the skill level, we've got low, medium, and high. Challenge level, low, medium, and high. So if your challenge level is low and your skill level is low, then you're in a state of apathy. If your challenge level is low, but your skill level is medium, then you're in boredom. Think about like,
Mm.
when you're growing up in school and you hear teachers say, oh, the kid's not challenged enough, so he or she's bored in class. Like, I don't know if you ever recall that that was a comment that was made during elementary school often. And then if your challenge level is low but your skill level is high, you're in a state of relaxation, which I think is totally okay if you want to take a pause and just sort of relax and go through life. If your challenge level is medium and your skill level is also low, then you could be in a state of worry. Or if your challenge level is high and your skill level is low, then you could be in a state of anxiety, which I think we can all appreciate. If your challenge level is high, your skill is medium, then you're in a state of arousal. And you're like, oh, what's going on here? Maybe I could embark on this path. And then if your challenge level is medium and your skill level is high, then you're in a state of control. So I'm flowing at the moment, but I definitely oscillate between flow, control, relaxation. I used to be in the anxiety worry space, but I figured out how to get myself out of that a little bit. So yeah.
Well, working in the technology and software healthcare intersection world is probably quite challenging most of the time, I would guess.
It has been. It's been a new space for me, but I think I've learned how to actually leverage technology. Once you get over that mental barrier of tech, I don't know how to deal with this. Once you get over that hurdle, I think it can actually really work for you. Yeah.
How do you see this applying to other healthcare providers? Are there any insights you could share that might be good little wisdom nuggets for them to incorporate into their day to day?
Oh, yeah, for sure. So actually, I think it totally relates in the healthcare space. And I'm going to start maybe by sharing this stat that I found. This was back in 2021. I was sort of doing a deep dive, going down a rabbit hole of like self-discovery, chatting with mentors in the medical space, and just trying to understand how physicians are feeling 10 years into practice, 15 years into practice, and are they having fun, right? And I wasn't hearing the best feedback. I kept hearing, jokingly, "Oh, quit while you're ahead." And I thought, "No, this can't be it." Until I saw a study done by the Canadian Medical Association, and it was the 2021 National Physician Health Survey. And it showed that 79% of physicians and medical learners lack professional fulfillment. And that means that they feel like they're not happy, they don't feel worthwhile, they don't feel in control, they don't feel like they're contributing meaningfully at work. And it kind of started to make sense, especially when I matched it with what I know about lifestyle medicine. And I know we're going to talk about lifestyle medicine a little bit later, but according some of the statistics I learned with lifestyle medicine was that 80% of primary care provider visits are related to a lifestyle or stress related factor or a behavior factor that requires a lot of individual independent work at home. But I feel like what we're taught in medicine versus what patients require from us when they come into the clinic, there's often a little bit of a gap there. And that can leave both providers and patients either in this state of apathy, worry, or anxiety, right? Not contributing meaningfully or not having that purpose, I can see how it might be a challenge for providers to be in that state of flow, right? So the challenge level might be very high, lots of paperwork to do, lots of administrative stuff. They don't get to do the clinical things that they enjoy. Maybe they're understaffed or always running behind on time. And their skill level might be low in that space. And a lot of it is because things are out of their control, right? Reimbursement models for time spent counseling, for example. So when you're in that state where skill level is low and your challenge level is high, you could be in that state of anxiety, right? And that's what I'm just sort of connecting the dots. If not anxiety, you could be in worry or you could be apathetic, just kind of mundane, going through the steps, seeing a patient onto the next, seeing a patient onto the next. And that report actually had some more alarming statistics in terms of the number of healthcare providers that were experiencing anxiety, the number of providers considering decreasing their clinical hours. So I definitely see this concept applying in the medical space from the provider side. Similarly, I guess with patients, if we want to say managing a chronic condition is the challenge, that is a super high challenge, right? Learning how to eat, how to move your body, how to address your mental health, that challenge is very high. And again, their skill level might be low. And so they could be super anxious. So now not only do they have a chronic condition they've been diagnosed with to manage, but there's like an automatic mental block because they're in a state of anxiety and don't know how to even begin with the first step.
And then, so is it a matter of, I mean, you can't always decrease the challenge level, right? It's okay, how do we increase the skill level? How do we equip ourselves better to deal with these types of problems?
Yeah, exactly. And so I think learning how to build that skill level, I think, is an important action item. It will come naturally when action items become prominent or become evident. So again, that's also according to the theory of positive psychology and this flow state theory. It's you're able to actually build skill, but you need to be able to build competence. You need to be able to have a clear identified action item so that you can actually move forward.
Are you a healthcare professional ready to take the next step in your career? Do you dream of a role where you truly make a difference in a community that's perfect for you and your family? Well then, let me introduce you to Cherry Health. Our platform puts thousands of healthcare opportunities right at your fingertips. Explore jobs by location, specialty, compensation, and more. All on an intuitive map-based platform, available on Android, iOS, or your computer's internet browser. Create your professional profile for free and get started messaging directly with employers. Beyond the app, Cherry Health also offers personalized, white-glove recruiting services who can guide you every step of the way. Your dream healthcare career is just a click or a phone call away. Visit www.cherry.health to start the next phase of your journey.
So you guys at My Viva Plan have been doing a lot of work to create a tool to start helping patients take control and be more proactive with their health. Is achieving this flow state part of the overall strategy?
I think formally it's not part of the overall strategy. I think that's my little cherry on top with it, with My Viva Plan. I absolutely love My Viva Plan. When I met Lorene Wales, our founder and CEO at the Lifestyle Medicine Conference, I was so wowed that within 10 minutes of talking, I was like, are you hiring? Because I needed to get super involved in the world of lifestyle medicine and I wanted to be able to help others deliver lifestyle medicine care. I guess I'll backtrack and say what My Viva Plan is all about and then match it to the flow state from the way I'm picturing how we can leverage the platform. So My Viva Plan means my life plan, and it's an evidence-based lifestyle medicine digital health platform. So in simplest terms, it's an app that you can use, and it's evidence-based. It's been built by regulated healthcare professionals such as dietitians, doctors, psychologists, and kinesiologists. So they've poured their expertise into the platform, and it serves as a diagnostic and prescriptive tool for healthcare providers interested in delivering lifestyle medicine care. And then for patients, it serves as the lifestyle medicine hub where they go to fill their lifestyle medicine prescription. And the program focuses on nutrition, fitness, and mental health. And the overarching goal is to get the individual reflecting, building self-awareness so that they understand who they are, what motivates them, and then building that intrinsic motivation so that they can make behavior changes that positively impact their diabetes, their cholesterol, their anxiety levels. So that's sort of the program in a nutshell. How that overlaps, in my opinion, to the flow state is we were talking about the flow state and how in order to get to that state of flow, challenges are opportunities for action. And so you need to be able to identify clear opportunities for action, which I think My Viva Plan does, right? Not only does it give you a specific meal plan for you to follow that's very personalized, it also allows you to make modifications and customize it, and it's dynamic with you. So instead of focusing on breakfast, lunch, and dinner and trying to make sure you're eating such that you lose weight or such that you control your blood sugars, that could be a little too overwhelming, right? And keep you in a high challenge state and low skill state. But if you break it down into a smaller actionable item, I'm only going to focus on breakfast foods. And you click a button in the program and the whole plan modifies for you. And all that shows up are breakfast foods that are aligned with your goals. Now you've got an actionable item that you can feel you can control, right? So you're automatically building your skill level because you've got a clear actionable item. Two, according to the flow state, you'll be more engaged in a task and you'll find things enjoying after you sort of uncover a little bit of the activity. So I'm going to give you an example. Oftentimes, you hear you need to lose weight, go to the gym and go exercise. If you don't like going to the gym and exercising, you're never going to do it. You're never going to get engaged. It's just not going to happen. But again, if you find a small actionable item, so My Viva Plan might suggest to you start walking and track your steps every day. Now, when you're on the walk and you're walking around your neighborhood, you're noticing the houses, you're noticing the trees. You're like, they have a nice lawn, or I like that front door. Maybe I should do that to my house. You're getting engaged in the activity because the focus has shifted away from you got to walk to lose weight, and it's things you naturally find enjoying, such as gardening maybe, or real estate or interior design or whatever it is. So now when you're walking, you'll uncover things about yourself or uncover enjoyment moments. Is that a word? Moments that bring you joy while you're doing that task. And that's going to keep you in that cycle of continued engagement in that behavior. So with My Viva Plan, you'll have an actionable item. Maybe it'll say walk for 10 minutes after your lunch meal, which is easy to do, especially if you're working from home. And then now when you come home, you're going to track your progress in your daily reflections. So you'll actually be able to note down, how did you feel after you went on that walk? Did you really enjoy it? Yes, no. If you did, you're going to engage in that more frequently. So that's sort of one of the ways in which you can achieve the flow state. The other concept or the other ingredient, I guess, is you need unambiguous feedback. You need to understand if your behaviors and your actions are helpful and moving you in the direction that you want to be in or not. And again, I think My Viva Plan does a fantastic job of doing that because of the fact that it tracks all of your lifestyle medicine vital signs. So it's going to document how often you're dining out, how often you're drinking water, how often you're drinking alcohol, how many fruits and vegetables you're intaking. All of that is going to be tracked and it's going to be captured in a graphic format. So when you are reflecting on your health, or imagine a clinical encounter with your healthcare provider, instead of the conversation being very vague and circling around, I'm not so stressed, or oh, I don't dine out a lot, I cook at home, you're now changing the conversation to, yeah, I noticed in January I was dining out 4 times a week, and this really impacted the way I felt. It was not helping my weight nor my blood sugars. And then you can dive in. Well, why were you dining out 4 times a week in January? Right? And now the patient can offer up, couldn't catch up after the holidays and go grocery shopping. Now, My Viva Plan again gives you another actionable item. Okay, so you were struggling with grocery shopping. Let's use the grocery feature on the platform to help facilitate building a grocery list so that you can meal prep. Right? So then it's a perpetual cycle that gets you moving along the skill level while also somehow decreasing the challenge as you get better at managing your tasks.
Well, it's really, I just want to emphasize this part about the feedback as to how things are going. And so one thing I've definitely seen is common through my weight management practice is you start off with the patient and you spend the entire conversation discussing like a SMART goal framework. And then I would say that historically, the vast majority of the time when you see the patient the next time, they have not done it. It's like you have picked a goal, you have picked this like specific target, and it often is in that tracking part where things fall apart. It's just like, it's very difficult to actually keep yourself accountable if you don't have a solid framework for measuring and seeing if you are actually holding up on this goal you created for yourself. And so just background for anybody else listening, I started using the platform of the My Viva Plan with some of my patients about, it's probably been like 5 months now, back in the late fall, early winter there. And it's definitely been quite helpful, actually, like giving them a tool that becomes harder to ignore, right? Because you get the pop-ups and the notifications asking you to check in, right? So previously the strategy was, okay, get your calendar out, use a whiteboard, something like that. But something that's portable and that's actually, in their pocket the whole time has been immensely helpful to starting to track and hold themselves to these goals that they're keeping.
Yeah, I love that. I think The word that came to my mind as you were saying that was accountability, right? You can come up with the smartest of smart goals, right? But then 99% of care is happening outside of the clinic setting. Even if you're the most fantastic physician, Jordan, and you're spending an hour with each patient, that's an hour how often? Once every 3 months, right? Even if you're seeing them an hour a week, that is still a significant amount of time they're at home fending for themselves. And I noticed when I use the app personally, I set all of these extravagant goals. I was like, yeah, I'm going to increase my fiber. I'm going to eat bulgur every day at lunchtime. I'm going to walk after each meal for 20 minutes. And so I set all these goals. And the system walks you through setting a goal so that it is a smart goal. But then when it came time to reflecting, I caught myself writing, oh, nope, I didn't eat bulgur today. And then I had a moment of reflection. Okay, why didn't I eat that? Oh, right, because I was traveling. Okay, so I couldn't eat that and I didn't get to cook at home. Well, I didn't get to walk 20 minutes after each meal. Why didn't that happen? And I was putting the connections together and I realized, okay, my goal isn't necessarily what I'm choosing to eat. My personal problem was the fact that I'm eating out a lot. So I need to change the goal in itself and maybe bring it back to let's cook lunch at home every day for the next 2 weeks, right? And so the goal shifts. Or if I'm dining out, okay, that's fine. I travel a lot, but let's make the goal I'm going to start eating vegetables first at the restaurant. I could still have fries. I'm not saying I'm not eating fries, but the point is I'm eating vegetables first, right? So it's dynamic. I think health is dynamic and we need to learn to get into this fluid state where we're not restricting ourselves because that's not sustainable, right? Anytime someone says don't look up, all you want to do is look up. So if you say don't eat this or don't do that, that's all you're going to do. So learning how to set smart goals, track it, and then also allow yourself to modify that, I think is going to be the key for sustainable behavior change.
Absolutely. And then the part that I'd glossed over initially, like when signing up on the platform, was around the education side of things. I was like, okay, cool. This seems like a neat little add-on. But like when you mention this sort of concept of the flow and having the challenge match the skill level, a lot of times that's where patients are struggling, is they just don't feel equipped to tackle some of these challenges. And so that makes it a lot less fun to play the game when you feel like you're losing, and feeling like you actually have the tools and the knowledge to tackle some of these higher level things, the meal planning, and how do I actually meditate? What do I do for my physical activity? Like, it's just so immensely important. So they're not feeling like they've been kind of abandoned in between. You can only see the patient so often at the clinic, right? And so having them supported in between with answers to these questions is incredibly beneficial.
I completely agree. And you're making me think of a story. So I had a friend that was diagnosed with diabetes and she was super overwhelmed. Her and all these patients, right? You've got to understand when they show up in the clinic space, they are automatically coming to you with a degree of stress and anxiety because they have a million and one things, just like you as the provider have a million and one things you want checked off, right? And so when you're in that state, are you even able to receive all the information that's being thrown at you? More often than not, you're not able to, right? You might pick up one thing and you're like, okay, yeah, got to do my blood work. Okay, got to make that appointment. And that's all you leave with. And so at home, you're fending for yourself. So this friend that I had that was diagnosed with diabetes, I went in to the diabetes education that she receives because she wanted some support. So I decided to go in and sit with her. And I was curious to see what that looks like. And they had all the diabetes educators there. And before they got into talking about what to eat, they asked if everyone is aware or understands what their A1C is. And some people nodded. And then she asked, okay, raise your hand if you don't understand what that is. And there was this gentleman that was 70 years old. He raised his hand. And he said, "Oh, hi, I've had diabetes for since I was 40 years old, and yeah, and I've been getting blood work and stuff, and my doctor keeps saying it's not managed, but I don't know what my A1C is. I don't know what that means. I don't understand the concept or I don't know what that means." So this poor man's been being poked for blood work repeatedly for the past 30 years, doesn't know what's being measured, doesn't know what's happening in his body, doesn't understand how eating bananas and mangoes might impact that. Now he's being scared because he's being told you can't eat this and you can't eat that and you have to eat this and don't do that. He has no idea what's going on. So I am a firm believer in knowledge is power. And I think the Vivapedia section of of My Viva Plan does a fantastic job with that. It's our encyclopedia of food. And you can just go in there and you can type in avocados, antioxidants, serotonin, whatever you want to type in, and it will give you foods that relate to that. And it'll tell you what are antioxidants, what foods are rich in antioxidants, what recipe you can make with blueberries that are rich in antioxidants. And it's great for patients, but I actually think it can be fantastic for providers. I often hear physicians say to me, we had a group of cardiologists that we were talking with actually, and they were talking about how they don't have enough time to adjust medications, especially if someone's had a heart attack recently or, had some type of procedure done. And patients are scared and saying, oh, my pharmacist told me not to eat bananas, or can I eat a pear? I don't understand. And so there's this misplacement of knowledge and the professional that they're asking. They're asking their cardiologist about food, but then they show up at the dietitian's office saying, can I take my statins in the morning because I forgot what the doctor said, right? And so there's this mismatch because we're constantly in that state of anxiety or worry. But if we've got knowledge and providers have access to Vivapedia, then they'll have the language to be able to relate in a very quick 2-second sentence. What are avocados? Why are they a healthy fat, right? What are antioxidants? Why should you be incorporating them into your diet? So I think it's a win-win for everybody.
I think a big part of where patients struggle as well is just with the health literacy part in general. And perhaps it does relate back to that match in the flow state of, am I just feeling anxious about this and therefore not very motivated or compelled to look into these things versus do I feel adequately equipped to start doing my own research, to start reading about some of these topics? And then, of course, as that education level rises, their understanding starts to increase. They start to understand the why behind just okay, I have to do an A1C, but what does this all mean for?
Exactly. It's a lot of different components that are at play, which is why I've learned to embrace technology, because trying to do all of this without having a tool in your clinic, I think is going to be extremely challenging. Just delivering lifestyle medicine care, first of all, is a little bit different than the allopathic approach to care, right? You've got to it's a behavior change. You have to change how you're delivering care as a physician. And so you might need a structure or a tool such as a digital app like My Viva Plan to help guide that. And I think technology is a key player when we're talking about coordinated care, right? So technology is a member, just like the patient, just like the physician is partner in care, all your allied health professionals. I think technology needs to be sort of at the center of that, bringing everyone together and keeping them on track.
100%, absolutely.
Attracting top healthcare talent is crucial for providing exceptional patient care, but connecting with the right professionals can be time-consuming and complex. Cherry Health bridges the gap. Our network allows you to showcase your organization, post jobs with precision and ease, and directly engage with healthcare providers actively searching for roles like yours. Whether you're an ambitious do-it-yourselfer or a seasoned recruiter, our intuitive web platform makes it easy to showcase your open roles and organize your applicants. Need a more personalized approach? Cherry Health Staffing Solutions offers dedicated recruiters to find and vet the perfect candidates for your specific needs. Build your dream team with Cherry Health. Visit www.cherry.health and start growing your team today.
And so we've been talking about lifestyle medicine and kind of alluding to some of these concepts, but for the audience who might not be super familiar with this term or this branch of medicine, could you define that for us?
Yeah, for sure. Happy to. So lifestyle medicine has actually become one of the most fastest growing medical specialties. And according to the American College of Lifestyle Medicine, it is the specialty that applies behavioral, motivational, environmental, and clinical principles to prevent, treat, or manage chronic diseases. So it's evidence-based. There has been a plethora of research supporting how lifestyle and behavior change can impact health outcomes for chronic disease. And I want to emphasize that it recognizes the same disease etiology and pathophysiology as allopathic medicine, right? So the root cause of diabetes, pathophysiologically is the same. There's insulin resistance happening. But the approach to managing diabetes now shifts from being predominantly lifestyle interventions to achieve that therapeutic effect. And the lifestyle interventions are centered around the 6 pillars of lifestyle medicine. And those pillars are eating in a whole food plant predominant pattern, adequate physical activity, restorative sleep, stress management, strong positive social connections, and the avoidance of risky substances. It's not crazy rocket science because, you hear about this all the time and it sort of is intuitive, but again, you have to be more specific and unambiguous with it, right? And so you've got to apply the research and set those SMART goals and be prescriptive with lifestyle medicine as opposed to generalizing, eat less, exercise more.
Well, it's one of those things where it doesn't really matter what type of provider you are. You could be a nurse, you could be a dentist, you could be a cardiologist, but no matter what patient conditions you're managing, it tends to always include a element of lifestyle medicine. Like, okay, move more, eat a little bit healthier, quit smoking, right? If it's your lungs that are the problem, the chronic disease of the day, if it's your heart, if it's your diabetes, right? Like no matter what's going on, this is always relevant. And the training we receive in medical school and in residency, we get into some motivational interviewing and a little bit around the basics of these, but then it's really where it kind of falls short and where I think a lot of providers feel ill-equipped to handle some of these more nuanced conversations with patients.
Yeah, I definitely agree with that. So you touched on so many different things. Dentists, yeah, especially in the space of acid reflux and the impacts of that on your tooth decay and enamel wear and all that kind of stuff. So yeah, so I've heard dentists really deep dive into oral health and how the foods that you're eating can impact your oral health and just overall wellness. And we're actually working with a dentist out of the Chicagoland area that has gone down the path of chronic disease management. It's interesting that you mentioned all different providers, whether you're a social worker, physician, dentist, there's a place to implement lifestyle medicine. And that's why I think it's so fantastic. And that's why I like that definition, meaning it's environmental, clinical, behavioral, and motivational. All these different fields can sort of come together with lifestyle medicine strategies. And you mentioned the motivational interviewing. I love that. I was first introduced to that way back in undergrad, and I think it's a skill that you need to develop. And it's an art, actually. It's a conversational art, and it takes a lot of being able to connect and communicate with your patient in that clinic space. I think it falls off naturally because in the typical clinical setting, you don't have enough time to get into those deeper questions, right? Because one of the things is you've got to ask open-ended questions, right? And that means you might have a patient that trails off into a long-winded story, right? And of course, there's an art in bringing that back into focus. And reimbursement models too, right? You're not always compensated well when you are engaging in that counseling. So again, I think you have to get creative with it. You can't always necessarily complain about money. There might not be a money tree waiting to be picked from, but leveraging technology so that you get rid of the mundane administrative tasks so that you actually have more time for a meaningful conversation, right? Again, that's why I love My Viva Plan, because even if the provider doesn't have time to get into it, the patient has aha moments when they are reviewing their progress, and they're naturally coming into the clinic and saying, I noticed that, I'm struggling with XYZ. Now the provider can actually review the graph really quickly and say, oh, I do see that. But they have the opportunity now to implement some of that motivational interviewing where they can ask questions to understand patient barriers or celebrate wins. I feel like you never celebrate wins in the regular clinical setting, right? It's always, okay, you got to do this
It's
blood
so
work.
important.
Yeah, it's super, super important, but you're on this autopilot checklist. But if you've got a little bit of time freed up or your data collection and review is a little bit more streamlined, then you can have more of that conversation.
Well, I think it really, really does help having something to refer to the patients once they're out, right? Because realistically, you can only see them for 15, 20 minutes, half hour, however often, right? It's not going to be an everyday thing. And so you need something to equip the patients with to be working on as their homework in between, right? So whether you're the psychologist and they're, trying to do their meditations or their breathing, their mindfulness, whether it's the dentist, you got to brush your teeth every day, you got to do your flossing, right? Or whether it's your meal planning, or right? So all these different things, you have to have something that the patients can start to refer back to and that's easy to digest. And I really love how the My Viva Plan tool like helps make that possible for them.
No, I definitely think you need to have that tool. And I think we'd be surprised with how much patients actually require from us. I think it's the quality that gets compromised oftentimes and the quantity. So then it's just like a lose-lose. But the amount of respect that the physician holds in the healthcare space, or I think in society still, is really paramount. And I noticed the shift, when you're in the field of medicine and all you do is interact with other medical professionals, you kind of assess yourself based on, if you're not a cardiothoracic surgeon, then you might be a nobody, right? But when you kind of get out of the bubble and you're in the world with other people, you recognize the respect that carries. And so patients really do come to you for answers, and you're on a pedestal, you're trustworthy care providers. And so they want to feel seen and heard and validated. And all that takes is a couple of sentences, right? All you have to do is, oh, fantastic. I see that you're drinking more water. That's awesome. I believe in you, right? And it sounds silly when I'm saying it like this, but when you're in that vulnerable clinical encounter, you will be surprised of how a few words can actually have a long lasting impact. And then a little bit of encouragement, and then they're held accountable at home by themselves with the tool, with their friends, if their friends and spouse and family are also engaging in the platform. So a little does go a long way, both for the patient, and then you feel good as a provider as well, that you actually made a change, right? Versus, okay, the same diabetic person came back in and nothing changed, and I prescribed the same meds and rewrote their prescriptions. Like, it's just, you're on an autopilot, right? So,
Oh,
yeah.
exactly. You got to kind of look for those opportunities to celebrate the wins too, right? Because this is huge in terms of the motivation and enthusiasm for the patient between now and your next visit, right? Like so often, right? It just, okay, patients gained 8 pounds. They're a little down on themselves, but it's okay. Well, that was the last couple months. Now we got to start focusing on, okay, well, how did you do with some of the sub goals, the mini goals? How did you do with X, Y, or Z component of that? And making sure that you're like, again, trying to foster, excitement over, okay, it has been going well in some domains. Maybe the primary thing we were looking at and evaluating went the wrong way, but how do we keep you motivated for the long term? And it's just critical to that sustainability over, not just what happened this month, but the next
Yeah.
year, the next decade.
Yeah. No, I completely agree. And the approach to lifestyle medicine care is that coach approach where you're helping the patient help themselves, but it's a strength-based perspective, right? Can you believe that 1 in 3 Americans have difficulty identifying their strengths? So if I ask you, Jordan, like, what are some of your strengths? You might struggle. I personally struggle, right? But I can rattle off the strengths I see in you. I'm like, wow, you're super tech savvy, you're entrepreneurial, and I can rattle all these off. But when it comes to identifying the strengths within ourselves, we might say, I'm not gonna lie, I'm really good at hosting podcasts, or I'm not gonna, like, it's always like you're feeling like you're boasting about yourself, or you dim your own light, which I think is an unhealthy space to be in. So we need to learn to embrace ourselves. Yeah, I gained 8 pounds, but over the holidays, I was such a fantastic host to all my family and friends. They love me. They love the joy that I bring. That's a positive. And now let's focus on how we can use that strength of connecting and apply it to a health goal. Maybe you need to join a walking club every Sunday morning with other moms because you like connecting with other people. So the goal isn't about exercise and about losing weight. It's about things that bring you joy, that get you eating healthier, get you moving more, get you to reduce your stress.
And so when it comes to the 6 pillars of the lifestyle medicine, how does the My Viva plan actually, what are your favorite parts in there that you refer patients to right out of the gate?
Great question. I guess I'll go through all the pillars step by step, because my Viva Plan is one of the only pillars that actually incorporates all of the 6 pillars of lifestyle medicine into one platform. So
Starting with sleep, what would be the first thing you direct the patients to?
that's interesting. I think the first thing I would direct them to is the sleep hygiene worksheet in the library section, you need to first understand what are the different factors that are related to sleep routines that are impacting the quality of the rest that you get. And then from there, if it's, you're not able to calm your mind down, then I would direct them to doing a meditation before bed on the My Viva platform. But start with the sleep hygiene action plan and then identify where you need to branch off to.
Okay, so important, just getting those core pillars of the sleep hygiene down. I have so many conversations with patients every week, and they're just doing something atrocious against one of those.
It's great that you mention with your patients that you sort of get into conversations about sleep and they're doing all sorts of crazy, unhelpful things. One thing I've noticed is patients sometimes don't understand the evidence behind restful sleep and how that can impact your weight and how having restful sleep can actually impact your hunger hormones, right? And I think being able to relay that evidence of how their hunger hormones, ghrelin and leptin, are out of whack if they're not sleeping restfully can actually impact weight gain. That is a light bulb moment, I think, for patients. And so now, not only do they understand it helps them with weight management, but they're saying, my doctor told me to sleep more, and they're more likely to actually follow through on that. So I think it's great to have that understanding, and the platform and the worksheet walks you through that.
If a person is primarily interested in nutrition, what would you refer them to within the app to get started there, the most important critical piece?
I think I would direct them to let the system build the meal plan for them. That's just me personally, because I think the nutrition pillar is probably the most complicated one and the most exhausting one to sort of wrap your hands around. So let the system build a meal plan for you and pick one meal that's your problem meal. If that's breakfast because you're always running out, or it's dinner because work ran late, pick one meal, let the system build it for you, and try to build a grocery list and adhere to that plan so that you allow yourself some time to learn and build on that skill.
And then if my patient's primarily interested in fitness, improving their endurance, their strength, their you name it, what would be the primary thing for them to look? Actually, let me try that one again. If my patient is primarily interested in improving their fitness level, what would be your favorite part of the app to refer them to?
So again, in the fitness section, I think the first thing to do is sort of assess your fitness level, your readiness for change, what equipment you have access to, right? So first understanding, are you new to exercise? If you're new to exercise, then obviously I would start off with actually incorporating a little bit more physical activity and movement, or breaking up periods of prolonged sitting. And so we've got a lot of different videos in the library section and printables in the library section that give you some quick stretches and mobility exercises to help break up periods of sitting. I would encourage people to start there, and then as they build that fitness level and the fitness literacy, they can move on to building a more customized fitness plan.
Okay, so it breaks it down from intermediate and beginner, as far as they want to go down that rabbit hole.
Yeah, and there's even assisted beginner, which I love because I always injure myself when I try to start a new regime because I'm new to exercising. So pick the assisted beginner level and do the modified routines.
Tell me more about like risky substance use and reduction there. Where would you direct a person if that is one of their primary goals they want to work on?
So this one is a very interesting one, and it's probably going to take longer. This, I would get them to focus on their daily reflections. In the daily reflections, they are prompted to answer a series of questions: how often they're drinking alcohol, how often they're smoking, vaping, cannabis, that kind of thing, how often they're engaging in other behaviors, such maybe gambling. Identifying what's happening in your life that is impacting you reaching for that cigarette or you reaching for that drink, I think is a first step. So you need to build that awareness, and doing your reflections and connecting the dots between how your thoughts and your emotions are impacting your substance use, I think is the first place to start with that.
Okay, and then let's say a patient's main concern is mental health, improving their mood, their anxiety level, their stress management. What part of the app would you direct them to best help them with that?
So the best part for that would be going into the meditation section, right? Mindfulness for anxiety. There's a lot of research behind how being mindful can sort of help you decrease your state of anxiety. So go into the meditation section and discover a practice that works for you. They're not 45-minute long meditations that you need to do, right? They're about 4 minutes, 5 minutes, 7 minutes. You can discover a practice that works for you, but you can sit and meditate, or you can learn how to do some deep diaphragmatic breathing or box breathing. There's different breathing tutorials that you can watch and learn. And I would say start there, control your breathing, activate that parasympathetic nervous system, and do it all within 4 minutes at home. That's where I would tell them to go to.
Okay. So many of my patients, often a large part of what's been going on or bringing them down comes to social isolation or just not feeling connected with a community. How can the platform actually help them on that department?
I love this question, and I've gotten super excited working with My Viva Plan and working with all the clinics that have integrated My Viva Plan to actually coming up with a framework for those providers to be able to host group medical visits. I know this might not be feasible in all different practice settings, but I think a great way to increase that sense of community and that social connection is if you start hosting group medical visits and leveraging My Viva Plan as the platform and building that community of other My Viva Plan users within your patient panel, I think is a great way to help build positive resonance amongst your patients. If you're not able to do that, my perspective on social connection actually starts with connecting to yourself. You need to be able to understand the value you bring to the world, why you're so awesome, and what makes you who you are, what brings you joy. And so being able to identify your values and connect with yourself is the first step. And we've got printable worksheets that you can do in the library section that help you understand your purpose, help you understand your values, so that you can then seek out connections that are tied to that, as opposed to simply seeking out connections that might not be meaningful. So that's what I would encourage.
Gotcha. So something in there for everyone.
Yeah.
Okay, right on. Well, Dr. Prerana Rudrapatna, thank you so much for taking some time to chat with me today about all the amazing work you guys in the My Viva Plan team have been doing. I really appreciate it. And again, I've been using the platform myself with my patients for quite a while now, and it's really catching steam. People are getting quite a bit of value out of it, and I hope it can continue to help more people out there. It's amazing.
Thank you so much. I really appreciated being on here. And yeah, good luck with everyone on their healthcare journey, whether they're patients or providers.
Thank you.